Dr. DeBeer here, Axon Integrative Health. Just here to chat about what concussions are and what that means to you, some underlying physiology that's happening at the same time and propitiating some of these symptoms, as well as talking about some predisposition to certain symptoms. So, a concussion results from movement of the brain within the skull that then creates axon shearing, which is how we get our name Axon. It's these parts of the nerves that connect these various nuclei so the communication can happen properly. When we have a brief stretch into that system, it creates essentially a scar tissue formation inside of that neuron. That scar tissue, or a healing process that happens, disrupts what's called neurofibrillary tangles, or again, some connections within the nerves that aren't functioning, aren't sending those signals properly down through that axon. We have a huge influx of calcium into that neuron and resulting potassium out of the neuron, creating an excitotoxic state for glutamate, which is our excitatory neurotransmitter in the brain. This is how we get a lot of the agitation, light sensitivity, all of this inflammation in the brain that's driving some of those symptoms. This is also increasing a demand of glucose in the brain, creating an energy crisis. We're not quite getting the energy in that we're expending out, so then the fatigue and the headaches can come on because of that. So, some of the risk factors leading into concussion can be if you're already having car sickness, or you have an eye or some convergence insufficiencies, or you already have headaches and migraines, or you already have anxiety. After a concussion, those same symptoms can be at higher risk for you as an individual. So knowing some of these things prior to any kind of participation in sports that could be concussion prone is a positive thing to know. That way, when we do get an injury, we can kind of suspect that these are going to be the following symptoms that you'll experience the most of. That also determines how we treat and what we do to help you as an individual as well, because just because you have a concussion doesn't mean it's the same concussion that the next individual also has. So your treatment styles may look a little different. Ultimately, improving blood flow, creating a connection into your breath work, proper nutrition, these three things are pretty basic across all concussions. Just things that we might do in the clinic are going to look different depending on which subtype of concussion you have. There are 6 different types of concussions. There is cognitive and fatigue. There is vestibular. There's ocular motor or vision. There's migraine headaches and blood flow, kind of autonomic nervous system regulation. There's anxiety-driven or psychogenic factors that lead into that concussion. And there's also neck strain and cervicogenic, or coming from the neck. So those 6 subtypes will also determine what treatment looks like afterwards. If you have a vestibular, ocular, motor, and cervicogenic issue, what we're going to do is drive a lot of eye movements, maybe some vestibular ocular rehab, no-nos and yes-yeses. We can also get into neck adjustments, chiropractic adjustments, things like that are going to really help. Training joint position error, making sure you know how far your head is in whichever direction, can also help create a brain-body connection into that neck and help heal from some of those symptoms. If we got a sports concussion or even a motor vehicle accident concussion, a lot of the times they're coupled with whiplash. So making sure that we can distinguish what are symptoms caused by the concussion and what are symptoms caused by the whiplash, can also kind of give us a determination for healing times. Concussion can take 3 to 4 weeks with proper management, sometimes a little longer. Whiplash on average is upwards of 10 to 12 months. So again, knowing the difference can also kind of tell you how long a treatment plan should last. So some of the biggest symptoms following a concussion can be dizziness, brain fog, loss of connection or feeling disconnected from yourself, headache, visual disturbances, nausea. If we have dizziness going on, that's unfortunately some of the predictor for a longer rehab time, a longer rehab process. Really not. This is because there's a lot of systems involved driving this dizziness. It's maybe not only vestibular, it could be ocular, it could also be proprioceptive. So having multiple systems involved can be detrimental to your recovery as well. It's not impossible, however, it just might take a little longer. So this, again, to kind of touch on those 6 different types of concussions, we have a blood flow autonomic dysregulation that could be happening. We have an inflammatory or hormonal imbalance that's going on as well. You have a vestibular ocular motor issue. It could be driven by neck biomechanics or cervicogenic concussion. It could be psychological, and it also can be a chronic concussion or chronic symptoms that came from a concussion a couple years ago that we've never truly treated. Making sure that you're treating the correct subtype of concussion is absolutely mandatory to be able to recover properly. If you're not working with a concussion specialist and trying to rehab this concussion through your chiropractor or your PT or somebody that claims to be a concussion specialist that is not looking at your specific subtype, you should find another specialist, someone who's truly worked with concussions and has good success. So I hope all this information is beneficial for you. And if you have any further questions, please don't hesitate to reach out. I'd love to help you and just kind of walk you through this process. If you do end up coming in for therapy, fantastic, but a lot of the times I love just to provide some guidance and support through this process. If you found this beneficial, if you want to send it to somebody, go ahead and share, like, save the post, and shoot us a message if you have any questions. Have a great rest of your day. Bye.